So with that, again, I would say they are not expecting you to be like a superhero or out of ordinary person, right? If I am from family medicine, what I'm looking at your experience. If you are hiring someone for a family medicine position, what do you, I would ask you guys, like, what do you like to look up on a CV if you're hiring someone for a family medicine position? Feel free to use the chat, write down some thoughts, what you think are relevant for a family medicine position or a family medicine residency. If you are hiring someone, you are reviewing CVs, what are the things you would like to see? Candidate with professionalism, good communication skills, patient care, candidate who should be hardworking, honest, resilient, empathetic, family medicine, clinical experiences, community service, communication skills, research, all good examples, right? So now you guys kind of know the answer to this question. That's how I would put this forth. Programs, if I am from family medicine, I am not looking at you having extensive academic CV. I am not looking at you having extensive teaching experiences, extensive research experiences, especially if you are not going into a university program, which yes, they do look at more research, more academic kind of candidate. But if you are applying for community programs, what are they looking at? They're looking at, are you someone who is relevant to family medicine? Are you someone whose personality is going to align with family medicine as a specialty? Right? So with that, someone having some family medicine experience, is that in US versus not, doesn't matter. If you are able to reflect on your family medicine experience back in India, back in or in any other country, you do have relevant family medicine experience. All these program directors who are sitting and reviewing these applications for years, they do understand that there's a big obstacle applying as an international graduate if you do not have that specialty specific experience. Okay. I applied for family medicine. None of my experiences on my CV were family medicine, except for my community medicine rotations back in India. People get surprised on that. But the way I reflected on my rotations here in US were very relevant to family medicine, were very relevant to me working as a resident coming from another country, knowing US system. For example, my first rotation was with a cardiologist. And the way I reflected on that experience is learning about US insurances, learning about how a clinic works, how they accept patients, how does the approvals get approved, different, how do insurances approve different treatments or different scans or different surgeries, right? Because that is a big part of US system that you're going to be working as a resident. Was my experience relevant to family medicine? No. Did I made it relevant to family medicine? Yes. Right? So now if a program director is reading my CV, they're like, okay, this person has some experience about US insurance systems. How do they work? Compared to if I'm just talking about patient experiences in cardiology and which is still going to be relevant for US family medicine, because as a family medicine, you are a person of different specialties combined in one, right? Because as family medicine, you are probably be managing rate control, rhythm control medications for your AFib patients, especially if their specialists tell them, yeah, no need to follow up with me in future, just follow up with your PCP. They will be able to manage your medications. If your patient is a CKD stage 3 patient, you can manage them by yourself. You do not have to have a nephrologist on board, because again, what are they doing? They're trying to prevent medications or prevent giving them any medications which can further exaggerate their CKD. Same way, anything like that. As primary care, you will be the one who will be a jack different games, right? So you will need to know something about everything and everything about something. If you can reflect those onto your experiences and reflections and takeaway of those rotations, that is what programs are looking at in your CV. Can you reflect enough on your experiences on your CV? So Comparing another example. If I see two CVs, both of them let's just take cardiology rotation as an example. Both of them applying for IM, both of them have a cardiology rotation in US or in India, doesn't matter. Actually, let's compare a cardiology rotation in US versus a cardiology rotation in India. And the cardiology rotation in US, you mention as saw these patients with these diagnoses, did daily rounds with the attending, or one other bullet point about, like, for example, presenting a presentation on this topic by the end of the rotation. Versus I see a person writing cardiology experience from India where they are mentioning very specific examples. For example, did daily rounds with the attending on a tertiary center hospital or in a this much bedded hospital. And then the next bullet point is saw these many average patients, including their chart reviews, physical exam, and coming up with a plan. Third bullet point being the on-call person for cardiac emergencies or the cardiac floor or the cardiac ward, addressing emergencies like this. Which one do you think is going to have more impact on the reader? One, which is the US experience, or two, which is the Indian experience? Again, utilize the chat. Give me your responses. What do you think? Indian, right? Because that person is reflecting a lot more on their experience and highlighting the best part of it compared to someone who did a US rotation but did not learn a lot or did not utilize the opportunity to express their learning on their CV. Right? So that's where your writing comes into play. Me having no family medicine rotations, none of my letter writers were family medicine, but I knew I want family medicine. I want to go into family medicine, and I explicitly expressed that on my CV, my reflections, my experiences, and I matched into family medicine. So those are the things which programs are most commonly looking at is, one, do you fit into the specialty that you applied? Second, can you reflect on the experiences that you are mentioning? And third, does the personality that we are kind of getting from reading the CV is going to match with the personality of a resident that we are looking at?